Good morning, everyone. I just want to do one quick sound check. Can someone let me know whether they can hear me?
Yeah, we can, Dan.
Yes, we can.
Thank you, Phil.
Yeah.
Apologies for that, guys. I was having a few issues with my sound. So, good morning, everyone, and thank you for joining our webinar. This is part 9 of our coronavirus webinar series. Just a bit of housekeeping before we get started. Anybody that's not joined before, this is a broadcast, so unfortunately your audio is muted. So if you do want to ask a question, there is a question box, and I'll come on to that on the next slide or two, where you can ask a question, and we're going to save some questions for the end. We're going to do a live Q&A. Hopefully you can see my screen here, my audio now. In terms of timing, this is booked in for half an hour, and we will finish half an hour. So 10:30 we will be finishing. The introductions, people we've got on the call, so with is Michelle Hobson. She's our HR Services Director here at Morpay. We've got Audrey Robertson, who heads up our HR consultancy. And then we've got Philip Barker, who heads up our health and safety team. And then you've got myself, Daniel Crooks, and I head up our product marketing team here at Morpay. So in terms of agenda, we're going to walk through current stats and any updated guidance from the government. Also, what's next for an employer. We've also got some consultancy, a consultancy offering that we're going to share with you guys. A bit around how we can support you from a payroll and a HR point of view, and then we're going to go to a live Q&A with the team. So I mentioned before. Let me just share I don't think you're seeing my screen, so let me just reshare my my screen, because this one is you do need to see this one. So when you on the GoToWebinar panel on the right hand, it's on my screen, it's on the right hand side, there is a box in there called questions. If you put a question in there, this is how we will see it. We'll get to see who's asked the question. I'm not going to name who's asked the question. I'm just going to read out the questions at the end, and hopefully get them answered. But the fact that we can see who's asked it means that we can go back to should we either, one, not be able to answer it, or two, run out of time, because we do get quite a lot of questions on these webinars. So feel free throughout the webinar to go and ask a question. We have got a chat bot which is available on our Knowledge Centre on our website. If you go in there and ask any questions around, well, the two big topics around the job retention scheme and also SSP. If you go in there, you will, and you should find pretty much most answers in there. But like I say, if you want one of our experts to answer one of your questions today, put a question in there. We'll get it answered. So I'm going to pass over now to Michelle, who I think this start is going to take us through the stats. Over to you, Michelle. Thank you.
Thanks, Dan. Can you go on to the next slide? Thank you. So just to kind of review where we are in terms of stats as of today. As of Monday, the 4th of May, there had been over 190,000 confirmed cases of COVID-19 in the UK, and that's resulted in just over 28,600 deaths. It's quite a significant leap since the last time that we did one of these webinars. I think when I was looking at it, we were around sort of 16,000, 17,000. So in the last 2 weeks, there has gone up significantly. And obviously, the risk to the UK, as declared by the government, still remains high. Just to stay on the stats a bit longer and talk about it, obviously there are very different ways in which the stats are reported, and the daily stats that are published by the government for deaths relating to COVID come in due to timing of reporting, so they can appear a bit more erratic. Some days we'll see a hike, some days we'll see a real drop and then a hike again. What we're starting to see emerge now, and it takes a little longer, is reporting by COVID, for the reason of COVID, deaths for the reason of COVID by date of death. And if you look at the graph on the right-hand side, this has been published by Public Health England, and this shows number of deaths per day and it's deaths that have been confirmed as COVID-19 with a laboratory test, and this is as of the date of death, and this shows within hospitals and then additional deaths that are counted. Now, you may have heard this date bandied around, and this is the 8th of April, and this is where we saw a real peak in the number of deaths that occurred on that actual day. But you will see that slowly since then, it is starting to move in the right direction. As more reporting comes in and more deaths are registered, this graph is continued to be updated. So you will see that the parts to the right-hand side will start to go up still and won't remain at those levels. But these are the sorts of graphs that are giving us, and obviously the government, a real sense of where we are in this peak, looking at the date of death rather than when it was reported. The other piece of information that's interesting is the Office of National Statistics. Now, they release their figures once a week, on a Tuesday actually, so it will be released at some point today. And they show deaths by date of death where COVID-19 is on the death certificate. So this also includes suspected cases. These do run a bit behind, and it's probably about 10 to 12 days behind. So you'll get data up to about the 25th of April this week. But between the Public Health England and Office of National Statistics, we're really starting to see what the actual curve looks like. And I think it's really important that people are pointed towards them. So just on to the next slide then, just kind of a stop check of where we are and what's happened in the last 2 weeks. We've been in our version of lockdown since the 24th of March now. It was due for review this Thursday, the 7th of May. We had the initial 3 weeks that was extended slightly, and an update done the following Thursday after Easter. And the government announced that lockdown would last for a further 3 weeks. We're now being told that the Prime Minister is expected to address the nation to unveil details of an exit strategy on Sunday, the 10th of May, so the Sunday of this bank holiday weekend, and we're expected to know more about it. There is lots of speculation in the media about what exit strategies may look like, what it may look like to try and get back to work in some form, all the health and safety requirements, details about people on furlough and how they'll come back. We are obviously monitoring the situation really closely at the moment. We are taking the information that's coming out, but we will be watching and waiting to find out the definite detail and be ready to turn that into practical and useful advice for you all. But this is really what this webinar is, to start letting you know from a health and safety and HR point of view, the sorts of things that we're starting to think about and that you and businesses can start to think about. Obviously, the furlough scheme is still running, and that will continue at the moment to the end of June. We may find out in the next week or two whether it will be extended before that, and it will very much be lined up with the exit strategy. But the portal for furloughing and claiming is live and accepting claims, and they are being processed. Another thing that might be of interest to you is that Ireland have now actually published their exit strategy in quite some detail. And whilst we have no indication of whether ours will form a similar pattern, it is useful to gain insights into what other countries are doing, and is definitely worth a read. If we go on to the next slide then, I'm going to hand you over to Audrey to talk about, from a HR point of view, what next for employers.
Good morning, everybody. The job retention scheme, as most of you will know, is due to end on the 30th of June. We're looking at nearly a quarter of the whole workforce of the UK currently being furloughed. It's costing a huge amount of money. It's likely to cost multiple tens of billions. But there's a judgment to be made, because obviously the cost of not having it is much higher. There are 2 million new unemployment claims, even with the scheme running. So, as Michelle said, we're waiting to see how it will end. But the latest news is that the Chancellor has said that it's not going to fall off a cliff. He understands that there are some issues with ending it very abruptly, and is looking at a plan to find a way out of it, really. It's likely, of course, that work itself will return gradually, and income in businesses won't return to previous levels straight away. as it stands, staff would have to return on the 1st of July on their original contracted pay, or else be made redundant or put on layoff. There's also a question about the minimum period of furlough being 3 weeks, and that means that in effect 9th of June would be the last day on which someone could be re-furloughed or furloughed newly. So we just really need to see what's going to happen there. There's been a few suggestions made. The Liberal Democrats have suggested a kind of tapering off scheme whereby there'd be some support for wages going forward, possibly for a month or two in sort of declining percentages. But we really don't know quite what's going to happen. So I think what we need to really be thinking about now is the sort of shape of the workforce in the future. If you can't furlough people part-time, if you're starting to reopen over the next few weeks, you'll need to be thinking about whether you can plan full-time hours for some staff and leaving others on furlough. And that's obviously a challenge because work isn't necessarily shaped like that. It does seem likely that quite a lot of organisations will end up looking at possibly significant redundancies, and how businesses bring people back from furlough can impact on those consultations later on. So it really is important to kind of be thinking ahead. For some businesses, they'll be making much larger scale redundancies than they've done before. And that brings with it all kinds of new responsibilities around collective consultation, longer consultation periods that are set out in law. So if that is something you think you might have to think about, now really is the time, not at the point at which furlough ends, whether that's at the end of June or at some point thereafter. And the other thing, of course, is that working from home may potentially change the shape of how we all work. Some employees are already asking their employers if they can stay working from home. And it's likely that lots of office workers who have worked at home will be among the last people to return. So again, it's time to think about a long-term approach to this, about the structure of the organisation. For some businesses, lockdown will have shown how well it can work. But obviously starting to work from home as a sort of emergency measure where everybody sort of rushed home with a laptop isn't necessarily the way that you might want to plan home working going forward. And lastly, of course, it's not out of the question that there will be other lockdowns for infection control again. Either there could be a second serious wave of COVID-19 in the winter, or we may be facing a future where this just happens occasionally. Perhaps now's the time to think about whether you do something differently if we were in the terrible situation of having to do it again. So in general, our sort of thoughts are that it really is now is the time to be thinking long term. Dan, if we just move on to the next slide. We've been thinking a little bit as well about mental health in the workplace and how things are affected here. So there have been probably about half a dozen fairly significant studies in the past that show how bad quarantine is for people's mental health. There were some done around Ebola. There's one about equine viruses where people were quarantined if they were around horses. So we do know that it's very bad for your health in two different strands, really. Firstly, people will have had all kinds of issues while they've been off, potentially quite damaging experiences such as bereavement or damaged relationships and so on. They may be worried about the future, about their jobs, have financial worries. So the other strand to that is that when people start to come back to work, some of those are compounded by sort of fears about returning, whether people will be safe, whether their workplace will be hygienic, whether their commute is safe, if schools go back in the very kind of limited ways that the government's currently talking about. A lot of people will have quite stressful childcare issues as well. So because it's important to get people back in a good frame of mind, it's important that employers manage this, particularly with really good, clear communication, structured plans, making sure everybody can feel as safe as they possibly can. And that's something we're going to be looking at in more depth in future weeks. In the meantime, as I've been talking about making people feel safe at work, I'm going to pass over to Phil now, who's going to talk a little bit about some of the health and safety aspects that are so important.
Yes, thanks, Audrey. I just want to move on to the next slide. We're there, sorry. Right, so there's, as Michelle mentioned, there's lots of discussion in the press around what coming out of lockdown might look like, what things businesses might have to put in place, and lots of speculation. I think the key thing is social distancing is going to remain. We are going to have to make sure people can work as far away from each other as they can within the offices. But one of the major steps I think that's been announced in the last few days, week or so, was that symptomatic workers who can't work from home can now get testing. So if somebody's showing coronavirus type symptoms and they have a job where they have to go into work, then they can request a test, and the link on the website is there. So you can go on, click on that link, and it'll tell you whether you're entitled to a test and how to arrange it, where to go for the test, whether it's a home delivery test, etc., etc. So there is an option there for employers to sort of make sure that people who might have had a cold are not having to self-isolate for 14 days if it's not actually COVID-19. So that is one positive step forward, and as the government wraps up the testing even more, then that'll obviously become a more widespread availability of testing, and will help employers maintain safety of workers within the workplace by knowing who has and hasn't been infected. One point to note is over the weekend, Michael Gove stressed that the UK will not be flicking a switch and going back to the old normal. In other words, the workplace we left in March is not going to be the workplace we return to in the next few weeks, June, July, August, whenever it looks like that we're going back to work. So we really need to be thinking around how we can operate our businesses in a world of social distancing, whether we need masks. Now, there's a lot of debate around masks. Are they personal protective equipment, i.e. do they protect the wearer from coronavirus in the atmosphere, or are they an engineering control that stops a contaminated person putting the coronavirus into the atmosphere in the workplace? So there's two real reasons for wearing masks, and there's two different types of masks that are suitable for each particular purpose. So if you're protecting the wearer, you're talking the P3 masks with the filters on. If you're protecting other workers from a contaminated person, you're talking about the surgical masks. So it's not just about wearing a mask, it's about making sure we use the right mask for the right purpose. There's a lot of talk about staggering work patterns. Now, in a workplace, this will help minimize the number of people that you're trying to get into an office, a factory or whatever, so that you can help with social distancing. So maybe if you operate a normal 8-hour shift pattern, you go to 2 8-hour shift patterns and split your workforce in half, or maybe go into a 3 work shift pattern and reduce it to a third on the site at one time. And I think 2 weeks ago we talked about how if you're doing that, you need to make sure you've got your first aid provision correct, your fire procedures and everything else. There's a whole lot to think about as we do that, staggering work patterns. Look at reducing use of public transport. I've seen some data over the weekend that cycle to work schemes are starting to take an upsurge as people that would normally use buses and trains to get to work are thinking about using the cycle to work schemes to buy bikes so they can cycle into work, to avoiding public transport. So as we mentioned, we're going to get more details later in the week. There's been a consultation process out there. Some of it's been leaked. And there's various people arguing about the pros and the cons. But in reality, as we're thinking about workplaces, the only real people who can decide what's right for their workplace are the people that run the workplace. The government can't turn around and say you will do A, B, C, and D, because they don't know what you're trying to achieve. They also don't know the layout of your building and the workflows that you need to operate. So the only people that can really decide that their workplace is safe to return to is the employer. And obviously, as Audrey mentioned, there's going to be a lot of anxiety from employees. You'll see this in the press with some high-name companies being called out for not doing what they need to do. They probably are. It's just that they're not engaging with the staff properly, and the staff aren't following the rules, or they're not aware of the rules. So at the bottom of the slide I put there, and it's probably the most true truism that's going to come out of this. This is the most important time for employers to consider risk assessments and consulting with the workers throughout that risk assessment process. If we are going to return to some kind of profitable way of working, we need to make sure that the workplaces are safe and that the staff are actually bought into the procedures and believe the workplaces are safe. So it's really key that we're taking the proper advice, following the proper guidelines, but also making sure our staff are agreeing that we're doing everything properly and that we can do to make sure the staff don't get ill while they're at work. So with that in mind, do you want to move on to the next slide, Dan? So to help employers do this, we're putting a package together. So existing HR services clients may already have consultancy time that they can use. Other clients may need to talk to us around putting some of this into place. But the idea of this package is it's a joint approach between my team of health and safety consultants and Audrey's team of employment law consultants. And we'll have a discussion with the employer. We'll try and work out what their objectives are, how they think they can get back to work. And then the two teams will go away and they'll work out helping the employer with risk assessments, bringing people back off furlough, and tailoring a package, a support package that helps achieve what you can do, that helps achieve the best result so that the employer can bring people back into the workplace as soon as possible in a safe working environment and really start to get the businesses running again. Anything you want to add to that, Audrey? Because obviously it's a joint package, this.
No, I think you've described it. It kind of does what it says on the tin, and it's available obviously not just to our HR services customers, but to our payroll customers as well. So, you know, we look forward to perhaps hearing from some of you about it.
Yeah, I think the idea is it's a small investment to make into making sure that you return and with as minimal fuss and the least disruption to business as possible, whilst keeping employees and safe and obviously willing to come into work. So I think that's me done. Dan, so if you want to move on to the next slide, which I think is probably moving on to questions, but I might be wrong.
Yeah, thank you, guys. The consultancy that Phil's just been through, if anybody is interested to find out more, if you just pop a note in the question box and we can follow that up after the webinar and get some more information out to you. There's a brochure that we can send over to you, and if you want, you can get one of the sales team to give you a call to talk through what that package looks like. So I just wanted to, we've got one last slide before we go into the Q&A, and that is just to talk around the services that MorePay have put together, but also offer as part of our standard package. So if I just go through them very top level, so fast track implementation, so anybody looking to bring a payroll to MorePay or bring another payroll to MorePay should they already have one with us, we're offering a fast track implementation, so we can get your employees paid just a net to gross calculation. That can be done within 48 hours. We can get that set up. So it just means that should you have a supplier or personnel failure, we can get your employees paid first and foremost. All our solutions, all our payroll, HR is cloud-based. They all have employee self-serve. So if you've got the payroll and HR system, employees can go in and they can do expenses through there. They can do holiday, their timesheets can all be done through the self-serve access, and it all goes through a hierarchy. So if their so their managers will approve, and it goes straight onto their pay, and all gets automatically calculated. We also offer some form of payroll automation. So depending on the package you go on, depends on how impactful this is. So if you're a managed customer, you can lock down. So each month the customer locks down, we can automate that. But if you're a payroll software customer, we can also automate elements of the payroll processing. So you could actually switch on automation for that just to make things a bit easier again. We offer a managed payroll support. So if you're looking to outsource your payroll, you don't want to keep it in-house, we offer a full managed service. You outsource it to a team based in the UK that manage your payroll. We've got HR consultancy available, and we've just been through what one of those looks like. That's not just the only HR consultancy. We offer a variety of support for businesses on a variety of topics. And we've also got we've got HR advice line, but also we've got a health and safety advice line. So should you have any issues, you want some guidance, you want to speak to some experts, you can pick up the phone 24/7, speak to a team of experts. They will give you best practice advice, and you can also insure that advice as well. And then lastly, we've got an employee assistance program. So it's very key at this, obviously in this current climate, these current times, to ensure that your employees are looked after. And EAP is a really good support tool that you can offer your employees, and it's something that we offer as well. So I just wanted to just go through some of the options that you've got, whether you be a new to MorePay or you're already a customer. So I'm going to go over to some questions. We've had a few questions in. The first question I'm going to go to is, how much can I communicate with furloughed employees? E.g., we are due to give an appraisal feedback in May. We only have a small number of employees currently furloughed.
I'll pick that one up. There's nothing to stop you communicating regularly with furloughed employees. They are still your employees, and we would encourage you to talk to them, including about any appraisal processes that you'll be instigating. There's nothing to stop them reflecting on whatever they need to do to take part in that process. And yeah, we would definitely encourage regular communication with people.
Okay, the next question, I don't know whether we might need a little bit more on this to answer it, but I have 3 members of staff who are classed as high risk. All have had letters from the NHS, but at different dates. All have been working from home, but what date do I use when we are back at work? The earliest dated letter on the last letters dated from the start of March to the start of April.
I think we probably would need a little bit more detail to be given a specific answer, but if they were contacted by the NHS, I think you would go off that first letter and what it said. So if they were if they were contacted, I don't know, on the 1st of April, and it said that they must isolate for 12 weeks, you would take that. So I'd go back to the letter that they first received, have a look at that, and then see if any subsequent letters overrode that. But it would be quite an individual thing that you'd have to work through. So I'd gather the letters or ask for copies of the letters and work with them to see what date they can come back. But I'd also be mindful that that may change. They've initially been told to self-isolate for 3 weeks if they are in the vulnerable category, for 12 weeks while they're in the vulnerable category. But that may change, and we'll just have to keep closely monitoring the situation.
Okay, thank you. Another question we've got is there any clarity on the ability to make staff redundant whilst they are on furlough? Does furlough pay count as redundancy pay?
Furlough pay is specifically excluded from what's termed in the guidance as redundancy payments. So that would certainly include using furlough money to make statutory redundancy pay, and arguably also for notice pay, although that's not quite so clear. There is no reason why you can't consult with employees over potential redundancies while they're on furlough. There's nothing to stop you doing that. You may need to observe slightly longer consultation periods if there's more than 20 of them, but you certainly can't use furlough money to pay redundancy pay.
Yeah, I'd echo what Audrey said there. Furlough is the money that's being claimed back from the government is to keep their employment. There isn't anything stopping you making a decision on making redundancies, and as time goes on, we will see, I think, more and more businesses having to reorg and understand that their workplace organisation will not look the same as it did pre-COVID. So businesses will start making decisions, but you must make sure that your redundancy pay is paid separately. Although it's not as clear, like Audrey said, on the notice pay, it would be wise to pay notice pay separately, but you can certainly consult. But again, it's something that you should seek specialist HR advice on to make sure that the specifics of it are taken into account.
Okay, thank you. We've got another question. In the interest of fairness and staff rotation following furlough, can we furlough someone who has returned to work? Is it the 3 weeks?
It is always a minimum of 3 weeks for furloughing. You can bring somebody back, and if you refurlough them, it has to be for a minimum of 3 weeks.
But there's no guidance. There's no guidance on. Sorry, I was going to say there's no guidance on what a minimum period of being back in in before you're refurloughed. So you could refurlough somebody after they've been back for a day or a week.
Yeah.
But as long as it's that minimum 3 week period they're off for.
Yeah, there's been no clarity provided on that part of it. Just the focus on it. Once they're furloughed, it has to be for 3 weeks, or they wouldn't be classed as furloughed.
Okay, and then I'm probably just going to do one more question, just due to time. I've just started to go over now. We have had people working on site and taking a number of measures already. Should we still do a risk assessment?
The simple answer to that is yes, because everything should be risk assessed. Coronavirus and the controls are probably a changing beast, so risk assessment should be reviewed regularly. And just keep things up to date. The testing is, that I mentioned, is one thing that obviously you need to rebuild into your risk assessment and your thought processes. There's potentially some changing guidelines that will come out at the weekend as to how the social distancing can be slightly lessened. And then there's the potential guidance changing around whether masks are a potential, the effectiveness of masks, is likely to be reviewed in the next few days as well. So all of that means that your risk assessments need to be kept under constant review. It's not just, and this is something I bang on about in normal times, not just under coronavirus. A risk assessment's a living piece of work. It's not a piece of paper that you complete and file away. It's a thought process. The piece of paper just documents your thought process. So yes, keep your risk assessments under constant review. That's probably the simple answer to the question.
Good, that's great. So I think just due to timings there were a couple of questions that we didn't get round to. We've had quite a lot of people asking around the back to work consultancy. So I will leave it open for anybody that is still interested, or any others that are interested in that consultancy. So just pop a note in, and then at least we know who to contact on that. We are going to put a webinar on next week, so that'll be part 10. So that'll be the 12th of May. For any further guidance, updates, go to our knowledge centre on our website. You'll be able to we update that on a daily basis. And I'd like to thank you today for joining, and hopefully see you next week. Thank you. Bye bye.